Well, thank you all for joining me as we keep the spotlight on the mega healthcare hike and give Republicans one last chance to join us and stop these premiums from skyrocketing across the country. I have been raising the alarm about this all year long, and Republicans have been trying to ignore it all year long. Literally, they chose to shut down the government rather than even talk with us about health care. Still, just because Republicans don't want to talk about something, that's never going to stop me from talking to my constituents about it and lifting up their stories and concerns loud and clear in the other Washington. And I will tell you, I have heard so many heartbreaking stories from so many concerned families when it comes to skyrocketing healthcare costs. I've heard from families across the country who are staring down unthinkable healthcare hikes, premiums doubling, tripling, worse. I'm talking to people who learned their monthly premium is jumping by hundreds and in some cases thousands of dollars a month. Americans who are making painful decisions, wondering how they can cut down on groceries or gas or other essentials to cover these rising premiums, or whether they will just roll the dice and go without coverage, even if it means skipping checkups or rationing prescriptions. Later on this call, Lisa from Washington State is going to share her story and talk about the healthcare price hike she is facing next year because of this Republican inaction. These stories are so important to drive home the reality for Republicans who keep trying to bury their heads in the sand. This is not some talking point. It is not some thought exercise. The mega healthcare hike is a reality that millions of families are facing in this country right now. And unless we take action, decisive, quick action this week to stop it, higher premium costs for millions of American families will be getting locked in for good. So time is of the absolute essence right now. The fact of the matter is this should have been happening months ago. We should not be having this conversation in the middle of December. If Republicans wanted to make reforms to the tax credits, the time for that was before open enrollment. But right now, the only thing we have time for is a clean extension of the tax credits, which is exactly what Democrats will be forcing a vote on this week. We need to stop the health care hike right now, and we need to save health care for the tens of millions of American families who are counting on us. We are way past the deadline. We're in overtime. Republicans need to understand it's literally now or never for stopping these premium hikes families are facing next year. And by refusing a clean extension and running out the clock, Republicans are choosing the never. But I'm not going to stop pushing. I'm not going to stop sharing family stories and keeping up the pressure so long as there's even a chance we can stop these premiums from skyrocketing and save millions of patients from getting priced out of their health coverage. I'm going to be pushing with everything I've got to make sure we get this done. And if Republicans refuse to do the right thing, the obvious thing, the thing their own constituents are begging us to do, if they refuse to stop this mega healthcare hike, well, our fight doesn't end at the end of this year. I'm going to continue sharing these stories. I'm going to continue holding Republicans accountable. And more importantly, the American people are going to hold Republicans accountable too, with their voices and their votes. And listen, looking past this fight to save the ACA tax credits, which is so critical, we still need universal health care in America. We have needed that for a very long time. It's always what I've fought for. So I'm going to keep pushing for reforms that make high quality health care that's actually affordable a reality for every American. And now I want to turn it over to Ingrid. She is the CEO of Washington Health Benefit Exchange to share some of her remarks. Ingrid?
Senator Murray, I can't thank you enough. Here at the Exchange, we're hearing so much from our customers. Open enrollment is really tough right now. People, as you said, are experiencing sticker shock. And I really want to emphasize what you said about a clean extension. We're overdue. We need this to happen. Literally, our customers are suffering and experiencing so much worry and anxiety about how they're going to afford something so basic and meaningful and important as health insurance. As you said, we need a clean extension. That's important. That means extending the existing policy as is not changing it into some other kind of policy, because we want to act quickly to pass on relief to our customers as soon as possible. So there are 220 Washingtonians who are benefiting from these enhanced premium tax credits. And we're in the open enrollment period that we're in now. We're seeing just a lot of activity, a lot of traffic coming in, new customers, existing customers, higher rates of calls into our customer support center than ever, lots of traffic into our health plan finder, our website, as well as people leaning into our in-person assisters. We're seeing fewer new customers this year because of what's going on. So far, 10,000 new customers have signed up, which is good, but that's 18% lower than last year. And significantly more people are coming into our site and then actively disenrolling because of what they're seeing. They can't afford it. So 12,000 people have actively disenrolled. That's 28% higher than last year. We're concerned that people are waiting and watching, and we want them not to do that. We need people to come in now. The deadline for new customers to sign up for coverage to begin on January 1st, 2026 is actually December 15th. So it's really important that people come into wahealthplanfinder.org and see what's available. We won't know the final outcomes of what this indecision by Congress will cause in terms of if the enhanced premium tax credit does go away. We won't see the final result until early next year, because people will passively disenroll just by not paying that first bill of the year. So the people hardest hit that I really want to emphasize, including those who their income is above or just above what's known as the income cliff, the ACA income cliff. And that's just 4 times the poverty level, which actually is a very modest income, $62,000 a year for an individual, $85,000 for a couple. They're the folks who, due to the policy change, if this expires, will no longer be eligible for any level of federal tax credit at all for their health insurance. And they're the ones who are experiencing the doubling, tripling, or even quadrupling of rates. Our average customer coming in who will no longer be eligible in that income bracket, the increase will be up to $800 a month is what they'll be seeing, versus last year a policy that cost $450 a month. And that's just the average. Many people are experiencing tens of thousands of dollar increases. So overall, thinking about like, what kind of choices am I going to make? How am I going to afford to pay for health insurance at $10, $20, or even $30,000 a year? What choices do I have to not spend money on other essentials, or to go back to work, or to think about what I might forego so that I don't earn income and I can still get this credit, because that's what's most important to me. So again, I just want to emphasize, Senator Murray, that as the state-based exchange here in Washington State, we stand ready to take quick action as quickly as we can to pass on relief. It's really important that, as you said, it's a clean extension so that we have that ability. And bigger picture, I think people need to think about this in the context, as you said, of universal coverage, of the right to access to health care for everyone. Big picture, before the Affordable Care Act passed, we had over 15% uninsured rate in Washington State. That's now down to less than 5%. And it's truly the folks who previously fell through the cracks of the system, those who are self-employed, small business people, people working on the gig economy, young people working jobs that don't come with health insurance, not plugged into a large employer plan, and those who are pre-Medicare age group, in the age group of 50 to 64, not yet ready, not yet eligible for Medicare. Those are the folks that before the ACA really had very few to no options, but today are insured due to this good policy and to the effectiveness of these enhanced premium tax credits. So to keep that in mind, and to support you and your colleagues in Congress to do everything you can and do in your power to get this extended and quickly. So thank you so much again, much appreciated. And I'll turn it now to one of our customers, Lisa Riveland.
Hi, thank you for letting me speak here and just tell my small story, because I know that so many people have a similar story. I'm retired. I think I'm probably on that income cliff that Ingrid was talking about. I'm not Medicare age yet, so I access my insurance on Washington Health Plan Finder. So for 2025, I was enrolled in a plan that I paid $870 a month for, and that included a ACA tax credit of $377. And this was not a top tier plan, you know, this was a silver plan. I'm fortunately very healthy for a person in her 60s and mostly have preventative and routine care. Obviously, right now, that $377 a month tax credit has gone away. So I went on Washington Healthcare Finder to get my plan for 2026. And I found that not only was that premium gone, but the plans had increased in cost by far more than just the loss of the tax credit, which was very frustrating for me. Many of those silver plans for people had relatively fewer, you know, needs to go to the doctor were gone. And the premiums were much higher. So what I discovered was continuing with my current plan would cost me $1,600 a month in a premium. Compare that with what I was paying $870 a month in 2025 and a very similar price in 2024 for the same plan. So that's the overall increase of $9,000 in a year. And as a retired person on fixed income, I simply don't have an extra $9,000 a year. So I searched on the plan for Healthcare Finder for a less expensive policy. What I enrolled in was a plan that costs me $1,353 a month. So that's $480 more a month than what I was paying last in 2025. This plan does not have as good a prescription medication coverage. This plan has higher copays for many visits. So even if I remain healthy and don't have any additional needs, this cheaper plan is going to cost me $6,000 more a year. So the obvious question for me discovering this when I was enrolling was, where does $6,000 a year come from for me when I'm on a fixed income? The reality for this year is I can pay part of that for part of the year out of my savings, but that's savings that I set aside for my long-term healthcare needs and for other expenses that I was responsibly planning to cover on my own. The other place that $6,000 comes out of is just basic things I enjoy in my retirement. I know that, you know, maybe this sounds like an extra thing that shouldn't be important, but I canceled my December plans to visit family for the holidays because I now don't have that money for travel. That's something that's very significant to me. So I want to emphasize that I am somebody who plans ahead. I planned for over 30 years for my retirement. I plan to be self-sufficient. I plan for inflation. I plan to cover my long-term healthcare needs. I plan for some modest activities and some, you know, modest gestures for my adult children. I feel like now that all of that cushion has gone away, and on top of really crazy prices in food and rent, my carefully planned retirement just got turned upside down on its head. And what I'm looking for before 2026 ends is having to go back to work in order to make ends meet. I can't tell you how frustrated and disappointed this makes me feel with a Congress that, by and large, I trusted long term to do the right thing. I feel like Congress is so easily turning its back on working and retired families and not understanding the significance of the loss of these thousands of dollars of income. I really hope that these stories get heard by our senators and representatives. I really hope that they can take some action now and show the respect and proper regard for their constituents that we deserve. We have paid into this system. We have bought into this system. We have been responsible with our money, and we do not deserve to have the rug pulled out from under us.
Thank you, Lisa, for sharing your story, and I am so sorry you are going through this, but what you just told us is exactly why Congress, we have one last chance this week, needs to extend these tax credits to help people like you and so many others who are going through this.
Thanks, everyone. We'll now open it up to any questions from reporters on the call. If you are a member of the media and you have a question, please use the raise hand function, and I'll go ahead and call on you. So I'll give folks a second to get their hands up. And we'll go first to Leah with roll call.
Hi, I'm Leah with Roll Call. Thank you for hosting this call. Senator Murray, I wanted to ask you, I think we saw just today there were several Republican health proposals being floated, some that would include some shorter term extensions of the ACA tax credits. I think I saw one that was 2 years, one that was 1 year. I wanted to get your response to those proposals. Is that something that you see there could be any kind of compromise come to on that?
Well, look, the time to talk about a compromise was months ago. Unfortunately, we are now at a point where enrollment is open. People are signing up. If we were to make changes to any of this right now, it would be really hard to have those implemented and to be able to help people as we go into a few weeks away when these plans start. So the only thing we can do right now is extend the tax credits as they are. I am happy to talk about reforms. I would have been happy months ago. But to implement that right now would be virtually impossible and hurt people like Lisa and so many others we have heard. So since it is such a late date and late hour, the only thing we can do right now is extend the tax credits as is. We're happy to talk about changes in the future or some kind of compromise, but now's not the time. It was 6 months ago. It was 2 months ago. It was a month ago, and that's gone.
Next, we'll go over to Evan with KGW.
Hi there, Senator Murray. You commented over the weekend about an immigration enforcement case where a dog bit one of your constituents. We're working on confirmation, but it appears in the video this was a Customs and Border Patrol officer that controlled this dog, not an ICE agent. So twofold question here. First, what do you have to say about this level of use of force? And second, do you have a comment about the blurring of the lines of which federal agencies are carrying out immigration enforcement?
The action was unconscionable. To unleash a dog on someone who was not provoking it, had no reason to be provoked. It is just astounding to me. I don't care if it was ICE or Border Patrol. No one with that kind of authority or anyone should ever unleash a dog like this on an individual in his own yard or anywhere. This was just crazy. I mean, they need to clarify, obviously, for a lot of purposes, who it was and why, and what authority they were acting under. But the whole thing is unconscionable to me.
All right, if anyone else has a question, we're going to do a final round for folks to raise their hand, or if you weren't able to figure out the raise hand function, you can also unmute yourself to ask a question. So I'll give folks another minute.
Hi there, Austin Reed with Apple Valley News Now, Cap KVU TV, ABC in the Tri-Cities Yakima area. Senator, quick question for you. Some critics argue that the credits are too costly. What's your response to concerns about the long-term budget impact?
Well, so last summer, the Republicans passed their so-called Big Beautiful Bill and gave away billions of dollars to the wealthiest of Americans in tax credits for all kinds of things. This is barely any part of that cost. And to people like Lisa and to so many people who are now going to either lose their health insurance or just barely be able to afford it, and the cost to our entire healthcare system when so many people drop out and don't have healthcare coverage is enormous.
Thank you.
All right, not seeing any other hands raised, we'll go ahead and pitch it back to Senator Murray to close us out.
Well, thank you to everyone. This vote this week is so important for us to extend the tax credits. It is one last chance we have to help people like Lisa and so many people I've heard from who are going to lose their health care insurance or have to do, as Lisa just said, cut everything that's important to them, including visiting their families at Christmas time. We need to act.